Now for the next muscle issue, it's kind of like in the neck. So we're looking at what is known as a torticollis. Okay, we're looking at torticollis. So torticollis, this is just what we got here. Okay, so it's kind of like rigidity in the muscles of the neck. Okay. Okay, so it's kind of like shortening of the muscles in the neck. So it's kind of like forcing the neck to tilt in one side. Okay, so what is torticollis? It has another name which is known as a wry neck. So it's a condition where the neck muscles, they contract abnormally, so they now cause the head to now tilt or twist on one side. Okay, so it can be congenital or you can actually get it, you know. So types, you have the congenital muscular torticollis, which is usually due to shortening or tightening of the sternocleidomastoid muscle, often linked to position in the womb. This is how the child has grown over time, so the body got used to that. We have the acquired one, where you are having all those spasms in the sternocleidomastoid muscle simply because of maybe infections or maybe traumas, maybe inflammation or maybe neurological disorders, or even poor posture, you know. So spasmodic torticollis is a chronic form in adults. It's on the neck muscles, they contract just like that, and it causes a lot of pain. Okay, so symptoms is the head is tilted to one side and you can't be able to rotate your neck like the way you want. Do you understand? So there's neck muscle stiffness and swelling. There's a lot of pain, and in infants it leads to some asymmetry facial features and the flat head syndrome if untreated, you know. So causes could be all those, you know, abnormal muscle development, fibrosis, hematoma in the sternocleidomastoid, or some syndromes like the Klippel-Feil syndrome. So the acquired one, that's the congenital one. The acquired one could be caused by infections, maybe trauma, neurological issues, maybe the person has had injuries there before. Medications or reactions, alright? Other syndromes like the Sandifer syndrome or the Grissel syndrome. Okay, so this is it for torticollis, and we'll move on next and talk about all those syndromes, and you guys will have a broader knowledge about it.